A stroke is a serious medical condition that demands immediate attention. It is a medical emergency that can have life-altering consequences if not treated promptly. It occurs when the blood supply to a part of the brain is interrupted, either by a blockage or a burst blood vessel. This interruption deprives brain cells of the oxygen and nutrients they need to function properly. Without these essential elements, brain cells can become damaged or even die within minutes. The effects of a stroke can be devastating, impacting a person's ability to move, speak, think, and function independently. Rehabilitation can be a long and challenging process. Strokes are a major health concern worldwide, ranking as the second leading cause of death globally and the fifth leading cause of death in the United States. The statistics are alarming and highlight the need for awareness. Understanding the seriousness of strokes is crucial, as early recognition and prompt medical intervention can significantly improve outcomes and reduce the risk of long-term disabilities. Education and awareness are key. Time is of the essence when it comes to strokes, as every minute counts in minimizing brain damage. The faster a stroke is identified and treated, the better the chances of recovery. Immediate medical attention can make a significant difference. Knowing the signs and symptoms of a stroke is crucial for enabling quick action and seeking immediate medical help. Recognizing these signs can save lives and prevent severe disabilities. Strokes manifest in various ways, but there are common signs that can help you recognize them quickly. Early detection is key to minimizing damage and improving recovery outcomes. Remember the acronym BE-FAST to identify stroke symptoms. It stands for balance, eyes, face, arms, speech, and time. Balance, sudden loss of balance or coordination. This can be a sign that something is wrong. Is the person stumbling or having trouble walking? They might feel dizzy or unsteady. Eyes. Sudden vision changes, such as blurred vision, double vision, or loss of vision in one or both eyes. These changes can happen suddenly and without warning. Face. Drooping on one side of the face, especially noticeable in a crooked smile. This is often one of the most recognizable signs. Ask the person to smile and observe if one side of their face droops. An uneven smile can be a clear indicator. Arms. Weakness or numbness in one arm. This can make it difficult for the person to perform everyday tasks. Ask the person to raise both arms and see if one arm drifts downward. This can indicate muscle weakness. Speech. Difficulty speaking, slurred speech, or inability to understand speech. They may also have trouble forming coherent sentences. This can be very frustrating for them. Time. If you observe any of these signs, even if they are fleeting, call 911 immediately. Every second counts in stroke treatment. Time is crucial for effective stroke treatment. Quick action can save lives and reduce the long-term impact of a stroke. Strokes can be broadly classified into two main types, ischemic and hemorrhagic. Ischemic strokes are the most common type, accounting for about 85% of all cases. They occur when a blood clot blocks an artery supplying blood to the brain. Hemorrhagic strokes, on the other hand, occur when a blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. This bleeding can put pressure on the brain and damage brain cells. Hemorrhagic strokes are less common than ischemic strokes but are often more severe. Transient ischemic attacks, or TIAs, often referred to as mini-strokes, deserve mention as well. TIAs are temporary episodes of stroke-like symptoms caused by a temporary blockage of blood flow to the brain. While TIAs typically resolve on their own within minutes or hours, they should not be ignored. TIAs serve as warning signs of a potential stroke and require immediate medical attention. Section 4. Risk factors. Who is at risk? While strokes can affect anyone, certain factors can increase your risk. Understanding these risk factors can help you take proactive steps to reduce your chances of experiencing a stroke. Age is a significant risk factor, with the likelihood of having a stroke doubling every decade after age 55. However, strokes can occur at any age, even in infants and children. Lifestyle choices play a crucial role in stroke risk. Smoking, for example, damages blood vessels, increases blood pressure, and makes blood more likely to clot, significantly increasing the risk of stroke. Maintaining a healthy weight, engaging in regular physical activity, and consuming a balanced diet low in saturated and trans fats can help reduce your risk. Certain medical conditions, such as high blood pressure, high cholesterol, and diabetes, can also increase your risk of stroke. Managing these conditions effectively through lifestyle modifications and medications is essential in stroke prevention. Section 5. Diagnosis and treatment. Diagnosing a stroke promptly is crucial for initiating appropriate treatment and improving outcomes. Every second counts, as brain cells begin to die within minutes of a stroke occurring. Doctors use a combination of methods to diagnose strokes, starting with a thorough neurological exam to assess brain function, including speech, movement, balance, and coordination. This initial assessment helps to quickly identify the severity and potential location of the stroke. Imaging tests, such as CT scans and MRIs, play a vital role in confirming the diagnosis and determining the type and location of the stroke. These imaging techniques provide a clear picture of the brain's condition, which is essential for planning the next steps in treatment. These scans provide detailed images of the brain, allowing doctors to visualize the affected areas. By understanding the extent of the damage, medical professionals can tailor their approach to each individual case. Treatment for stroke depends on the type, severity, and location of the stroke. A personalized treatment plan is crucial for addressing the specific needs of each patient. For ischemic strokes, the primary goal is to restore blood flow to the brain as quickly as possible. This rapid intervention can significantly improve the chances of recovery and reduce the risk of long-term disability. This may involve administering medications to dissolve the blood clot or using minimally invasive procedures to remove the clot mechanically. These treatments are time-sensitive and must be administered promptly to be effective. Hemorrhagic strokes require different treatment approaches focused on controlling bleeding and reducing pressure on the brain. This often involves a combination of medical and surgical interventions. Medications to lower blood pressure and reduce swelling in the brain may be used. These medications help to stabilize the patient and prevent further complications. In some cases, surgery may be necessary to repair the ruptured blood vessel or relieve pressure on the brain. Surgical intervention can be life-saving and is often the best option for severe cases. Section 6. Life after stroke, recovery and prevention. The road to recovery after a stroke can be challenging and vary greatly depending on the severity and location of the stroke. Rehabilitation plays a crucial role in helping stroke survivors regain lost function and adapt to life after stroke. Rehabilitation may involve a multidisciplinary team of healthcare professionals, including physical therapists, occupational therapists, speech-language pathologists, and psychologists. Physical therapy focuses on improving strength, coordination, and mobility, while occupational therapy helps individuals regain independence in daily activities. Speech-language pathologists work with individuals who have difficulty speaking, understanding language, or swallowing. Psychologists provide emotional support and help individuals cope with the psychological and emotional impact of stroke. Preventing a second stroke is crucial for individuals who have experienced a stroke. Lifestyle modifications, such as quitting smoking, maintaining a healthy weight, engaging in regular exercise, and eating a balanced diet, are essential. Strokes are serious medical emergencies that require immediate attention. Knowing the signs and symptoms of stroke and acting fast can make a life-saving difference. By understanding the risk factors, we can all take steps to reduce our risk of stroke and live healthier lives. Remember, stroke prevention is a lifelong commitment. By making healthy choices and managing our health, we can protect our brains and enjoy a brighter future. Hope you liked this video. Please subscribe for more helpful medical videos like this.